yes, there's a problem. Technology, definitely not. Bureaucracy, definitely yes. So these are the two things we have to address, right? Litigation, I won't talk about that today. The bureaucracy. How do you control cost? I mean, this is what we're talking about. Healthcare is a disaster right now because of this cost. All right? Do you adopt the Soviet model, right, where you're managing everything? The price of materials, labor cost, employment assignment, fuel cost, demand, innovation. All those things you have to get your fingers into if you want to control cost using the central planning model. Central planning model, of course, never works because you're dealing with human endeavor of unmanageable complexity. This is the cat herding model of controlling cost. And it denies basic human motivation. The motivation to manage your own life, to manage your own resources, to manage your own future. I don't want somebody telling me what patients I'm going to take care of, or what specialty in healthcare I'm going to go into, or how much I'm going to be paid for my services, because it denies basic human liberty in order to achieve something that's unachievable. And, of course, history proved that amply. So we get back to this idea of subsidiarity. A very important concept is subsidiarity. You manage it at the most local level possible. So Lappert's rule number one, the most efficient place to control cost is at the point of sale. This is not obviously my rule. This is basic economics that anybody who sat through even the first 20 minutes of an economics class could tell you this, that if you really want to control cost of something, control it at the point of sale. Because this is how a free market works. This is why free markets are so successful. All right? Rule number two is that people are most frugal with their own money. This obviously informs rule number one. And the corollary to that is that socialists are only generous with other people's money.
Until it runs out.
Until it runs out, yeah. As Margaret Thatcher said. Yeah. The problem with socialism is eventually you run out of other people's money. Yeah. Okay. So, what if, this is the big what if individual families or individual people were allowed to compete directly in the insurance market? What if, you're just spending your own money instead of the system that we have now? Obviously, you got to ask yourself, is that really affordable? Can anybody actually do that? But what we know is that if that were possible, you'd be reducing costs at the point of sale because you're spending your own money for the service. It removes all the issues of injustice. I mean, if people are spending their own money and they want to hang around the emergency room spending their own money, fine, this is good if you want to do that. If you want to spend your money on a CAT scan because you're hysterical that maybe you bumped your knee playing racquetball, you want to spend your money on a CAT scan even though the doctor's saying, your knee's fine, I want the CAT scan. Well, if I was in his insurance program and he's driving up my cost because he's getting all these unnecessary studies, then I'd have a sense of injustice about it. If he's on the public dole and he's spending my tax money to get a CAT scan because he's in there whining about his knee and demanding a CAT scan, I feel there's an injustice going on here. If he's spending his own money, I could care less. I could also care less about his personal habits. If he's a smoker, if he wants to blow his health smoking cigarettes, that's his decision. I don't care. Don't smoke in my house. That's something I got control over. But I don't get all in the weeds about his private life anymore. Right? This is important for America to get back to, is it not? Okay. Now, is it something you could do? Who could afford that? In the state of Alabama, in the past fiscal year, the average family of four on health insurance premium, including the contribution by their employer and their own contribution to their insurance, approaching $13,000 a year. $13,000 a year paid out for their insurance coverage. If you were putting $13,000 a year into a health savings account that is invested pre-tax dollars, invested in the market and producing income, 10 years of employment produces a pretty significant pile of money there. Pretty significant pile of money. And if you're a young family, and this is your form of coverage, and you want to gap into, you want to have the coverage, but you don't have enough in your HSA now, then you could conceivably have something that's the equivalent of a term policy that you're paying X amount of dollars to, that the insurance company knows what your actuarial risk is. Just like a life insurance term policy, they go, well, we'll charge you $50 a month for this catastrophic coverage, right? Until you got enough banked in your HSA, and now you're on your own, right? The problem right now is that what started out as the Archer medical savings accounts that's morphed into the health savings account boxes you into, it requires that you have a high deductible, high premium catastrophic policy behind that. And they put minimums on that. So for an individual, they say that the minimum of the premiums is somewhere around $3,500, and for a family it's somewhere around $5,060 per year in premiums. Okay, so you can have your health savings account, but right now you're boxed into these high deductible, high premium policy to back it up. Okay. The other problem with the health savings account approach is that you, as a spender out of your health savings account, you don't get to see that nice bill that's the reality. You see the bill that's the fiction. You get the fiction. The insurance company doesn't get the fiction, right? Medicare doesn't get the fiction. You do. All right. So this is where the legislative effort has to direct itself. Has to direct itself at transparency of that bill. Okay. Because if you're using your pre-tax dollars to pay for something that is actually priced the way it deserves to be priced, that gallbladder wasn't worth $77,000. That gallbladder was worth about $7,200. Now $7,200, think about that. People go out and buy home entertainment systems for more than that and put them on a payment plan. If you had been with your employee for 10 years and you were depositing about $13,000 a year into that thing, after 10 years, you might have somewhere around $150,000 in the thing, including what interest you earned on it. And in fact, on that $150,000, $7,000 is the interest you're collecting this fiscal year on that account. Yeah, catastrophes ain't that catastrophic, are they? And you're in complete control. You go to the hospital and he says, yeah, gallbladder, it's got to come out. What's that going to cost me? It's going to cost you $7,000. You go, you know what? Let me make a call. Oh, wait, $6,200 we can get this done for you. Cool. Cost controlled at the point of sale. Reality in the price structure. Individual control. No issues of injustice. Okay. No new administrative structures are needed to do this, really, other than the transparency of the bill and access to that same price structure. If it were the case that I, as a health savings account holder, paid, say, no more than 4% above what Medicare pays, right? The hospital is making more money on me than they're making on the third-party payer and Medicare, so now I have become their favorite guy. I'm the guy who pays more than anybody, and still I'm spending less on health care than I was when I was paying my premiums. The hospital's doing better. The community is doing better. Families are doing better. The state's doing better. Everybody's doing better if that's all you do. So if you have access to the same information as a private person and access to the same price structure, and you can even make me pay more than these other people pay, I'm still doing better. Everybody's doing better. Okay. It self-regulates, as we talked about already, and it keys it to existing structures. The Medicare book comes out every year. You don't have to come up with some new pricing scheme. All you got to do is set it. No more. You cannot be billed any more than X% above what Medicare's paying. Okay. This has zero impact on Medicare funding. You don't have to wring your hands about, well, what about the care of the poor? You know, the money that's going to Medicare, blah, blah, right? It has no effect on that. You're still getting taxed blind to pay for Medicare, but you're not adding to the taxes on Medicare, right? So it's neutral effect on Medicare, right? It actually is relieving Medicare spending, right? Because now you're not forcing people, you know, when the insurance company gets tired of you, you're not kicked into Medicare in the single payer system that we have in Alabama, for example. Alabama has a single payer system, right? Blue Cross till you're old, Medicare till you die, sequential model, right? Well, in this system, if I've got a health savings account, I've got my own money in there, and I can get the best service and whatever I want, why would I go into Medicare? Why would I do that? Makes no sense to me, unless I'm flat broke, unless I mismanaged my health savings account because I insisted on CAT scans every week for my knee that I didn't really hurt, whatever. Right? So stupidity always lands you in the arms, or can often land you in the arms of charitable organizations, but, right? So significant numbers in the next generation, though, will stay away from Medicare because you established a process for young families in the state of Alabama, right? You're relieving industry of managing insurance plans. They don't have to calculate 50 years out with retirement plans of what the impact of this negotiated health insurance deal is going to do to the price of their products 20 years from now. It's like, it's a non-issue, right? Yeah, okay, X number of dollars will come out of your pay and go into your account. Thank you, goodbye. You got to go to the doctor, let me know.